topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, Nashville. Welcome to another Ask the Expert show, where we bring you the top experts in the field of legal, health, financial, and home improvement. Well, I got to tell you, people, we get so many letters going. I don't know if you read my email or not. I read every single one of your emails. And for a long time, we were getting so many emails, people going, how come you don't do a show on LASIK, eye surgery, cataracts? And we just didn't have an opening. We finally got an opening, and we were so lucky that we got the top ophthalmologist in the whole state of Tennessee with the Wang Vision Institute. And ever since we've added this show, we get so many letters thanking us for bringing this show. And I got to tell you, our expert today, we call him Dr. G. Dr. G, people love the way you explain everything. Welcome to the show.
Thank you, Steve. I really appreciate it, and thank you for this platform. I mean, that's the whole point of this, to educate patients and kind of raise awareness.
And I got to tell you, you're so busy, and I sometimes I failed to do this, but we cannot thank you enough. You take out 30 minutes of your schedule to sit here and educate people. And I just want you to know how much our listeners and our viewers appreciate you. And they love the way you answer the questions and you don't talk over people's heads.
Good. I love it.
So Wang Vision Institute, major clinic, I say in the state of Tennessee, because we're getting letters from all over Tennessee about your show. Tell people about Wang Vision.
Yeah, so Wang Vision Institute was founded by Dr. Wang about 20 some years ago, and we are kind of a premier refractive cataract surgery group. So I do 8 different surgeries to help patients out of glasses. So just depending on your age, your prescription, your goals, we're kind of the premier place that has all the latest technology. We use lasers for all of our surgeries to kind of add an extra level of safety, kind of have access to the newest tools and any kind of new products that come out. Typically, we're kind of having them first. You know, we perform many of the first surgeries in Tennessee.
Well, we got a letter the other day. People saw that you were coming on. Wanted to know, do you do any pediatric work?
That's a good question. So ophthalmology, the eye is about 1 inch long, but then there's over 12 subspecialists where you can train. So I trained at Hopkins, then Duke, and then I did a subspecialty in refractive surgery, so kind of a front part of the eye surgeon. So just like that, pediatric ophthalmology is a different fellowship. So just, we do see kids, but typically if they're able to cooperate with the eye exam, they're a little bit older. So kind of anyone 12 and above, we'll see them. But anyone younger, we recommend going to see a pediatric ophthalmologist.
Well, we're going to be talking about dry eye today. And for those of you who have been writing us about cataracts, I was just talking to Dr. G about it. We're going to probably do a show next month on cataracts. So we appreciate, again, all your letters. So let's start off with what exactly is dry eye and what causes it?
Yeah, good questions. Good questions. So, dry eye, I mean, just to set the stage, has a prevalence about, there's about 16 million people in the US that probably have diagnosed dry eye, and probably an additional 6 million that have undiagnosed dry eye. So, symptoms of dry eye can range from foreign body sensation in the eyes, gritty feeling like there's something in there, irritation, redness. Fluctuating vision. Oftentimes, when people are tearing, they think, hey, I can't be dry. But in fact, that's actually a symptom of dry eye. So the eyes get so dry that the emergency pump signals of the eyes start to create some tears, but they're very low quality tears. Um, so those are all
What
kind of.
causes the caking, Dr. G?
Yeah, what causes the caking, kind of the morning crusting. So what happens
Yes.
is when the eyes are dry, all those kind of deposits just kind of evaporate and kind of clump together on the eye like that. So anything that's kind of being secreted isn't really nice and healthy. So we have kind of 40 oil glands at the top of our eyelids, 20 oil glands at the bottom. And whenever we blink, those oil glands are secreting oil so that the tears stay on the eye longer. Yeah, you can imagine if those oil glands get dysfunctional, there's less oil on the tear film and the tears evaporate much faster. So, that's called decreased insufficiency a little bit, just decreased quality because they're evaporating. So there's an evaporative component to dry eye. And then there's some conditions where people have where they just don't produce enough. So there's what's called aqueous deficiency. So they're not producing enough tears. And then there's evaporative dryness where the tears are just evaporating really fast.
What causes it?
Good question. So the evaporative component is caused by gland dysfunction. So those oil glands, what they happen is they start to get clogged. I don't know if you've ever had a sty, but it's the same thing that causes a
Yes.
sty or chalazion. What happens is those oil glands get clogged. And when those oil glands get clogged, oil kind of builds up and then inflammation kind of follows, causing a little bump, causing a sty. So it's the same, it's called MGD, meibomian gland dysfunction. So that's a big cause. Typically, we can see that in just natural aging, kind of as we get older, the skin kind of dries out, face kind of dries out, so do the eyes. Same with the glands. They can start to do what's called atrophy and die out if not taken care of properly. Other conditions like autoimmune conditions, people that are on certain medications, diuretics, those will kind of contribute to drying out, especially people with conditions like Sjogren's, which is an autoimmune condition that causes dry eye, dry mouth, all of it.
So, how can someone tell the difference between, say, normal eye irritation and chronic dry eye?
Good question. Oftentimes, and this is a big no-no, people use Visine. So you definitely don't want to use Visine. Visine has something called get the red out, and the more
Yes.
the more you use it and you stop it, it can actually cause what's called rebound redness. So you don't want to use Visine to kind of treat dry eye. If you find yourself using artificial tears, more than 3 to 4 times a day, that's telling you that, hey, maybe there's something underlying going on here, and it's not just a transient irritation. What the artificial tears do is kind of supplement the tears, but it's not treating any cause of the dry eye.
Is dry eye is dry eye just a nuisance, or could it actually lead to more serious problems?
Good question. So dry eye, I mean, the way that I kind of describe it, it's like trying to look through a dirty windshield. Can we do it? Yeah, but do we want to do it? No.
No.
The quality of the vision, the quality of how you perceive things, everything will be degraded. And if left untreated, in theory, it could continue to cause what's called corneal scarring, corneal hazing. It can lead to recurrent styes. It could just lead to the eye looking red, angry. So it's not going to damage with like your retina or your optic nerve, but it does kind of contribute to the overall quality of everything. Similarly, if you wanted to have any surgeries, whether that be SMILE or implantable contact lenses or cataract surgeries, if you have really bad dry eye, it can affect the outcomes.
I guess people probably want to know what types of patients are most, would you say, are at risk for dry eye disease?
Yeah. So anyone kind of with autoimmune conditions,
Okay.
anyone with chronic contact use, anyone kind of females above the age 40 with the hormonal changes, they'll tend to be drying out a lot more faster. Elderly population, just like the skin and everything kind of dries, so do the eyes. And again, some post kind of surgical patients as well.
We just got our first text in. I'm so sorry I missed the first part of the show. I really wanted to see this show. I think I have dry eye problems. Can you explain the different types of dry eye and why that matters for the treatment?
Good question. So the two types of dry eye are evaporative dry eye and tear insufficiency. So in evaporative dry eye, what's happening is your body's not secreting enough oil onto the tear film, so the tears are evaporating really fast. And then in tear insufficiency, your body actually isn't producing enough tears, so you don't have enough to kind of cover the eyes. So there's different tests that we can do in the office to kind of determine which kind you have. But in terms of treatment, there are certain treatments that can be titrated to the cause, but oftentimes there's a big overlap. So oftentimes we use the same therapies for both kinds of dry eyes. Typically, go ahead.
It seems like, people this is just to them, I'll get over it. And they do nothing about it. Does it actually get worse?
Yeah. So dry eye, if left untreated, just kind of slowly gets worse. That's why we actually describe the disease as a chronic disease. Truly, even with dry eye, all the therapies that we do can help treat the underlying cause, but to fully eliminate it, patients often still have to use some kind of maintenance therapy. So even after we kind of get it under control, we recommend kind of high quality artificial tears. It's kind of like brushing your teeth, to kind of maintain that nice tear film.
You spoke just a minute ago about Visine. What are some of the over-the-counter options people usually could try first and to see if they're effective or not?
Yeah, so one, you want to check to make sure we typically like what are called preservative-free tears. So they don't have any preservative in the bottles, meaning it's less toxic on the eye. Now, if you're using the tears just 3 times a day, the non-preservative one is probably okay. But if you're using anything more than that, you want to get a preservative-free version. There are certain brands that we like. We like Sustain, we like Refresh, Octase. So a lot of good options out there. You guys have probably all seen, recently in the news, there were actually some few eye drops that were recalled. So one, you want to always make sure you want to check FDA listings to see if any of the eye drops have been recalled. So a lot of ones that were recalled were off-brand ones like the Walmart, Equate. So we recommend using on-brand drops.
I was at a CVS the other day, and I was going down the aisle. I was shocked how many different types of eye drops there are. There are so many different kinds, and I don't know, are they all effective?
So all the over-counter ones, they're all supplementations for your tears. So none of the over-counter ones are treating the causes, but they're supplementing the evaporative component. So some of the tiers have a little bit more oil in them, so they last a little bit longer. Some of them are formulated with a little bit of what's called a nanotechnology, so it lasts longer. But essentially, all of them are supplementing the tiers. Really, depending on your cause, one may be slightly better than the other. But for the overall average person that just wants to try something, just using what's called hydration tiers, sustained hydration or refresh tiers, those are good ones.
So let's say someone's using these eye drops. How long should you give it before, if it's not working, you should see a specialist at Wang?
Yeah, I mean, one, if you're having any of these foreign body sensations and things like that, and now you've tried the tears and it's not working, that's when it's time to come in. The earlier you come in, the earlier we can start kind of treating everything and kind of getting everything to a good baseline level. You don't want to just try it for a few months and then say, okay, this is not getting better, because now you've just suffered for
Right.
a few months. Typically, what we do is if you come in and you have really bad dry eye and you've already started artificial tears, there's different options that we can do. There's lots of prescription eye drops that target the inflammation. So what happens is when the eye gets chronically inflamed from the dryness, it's kind of like a positive feedback loop. That inflammation causes more dryness, and the dryness is causing the inflammation. So all of the prescription eye drops target that inflammation, kind of different receptors, different areas of the eye, to help control the cause. So prescription drops are things that we could do. We also offer a lot of procedures in our office. So we're kind of a dry eye referral center here in Nashville to treat a lot of dry eye people that have seen other providers and couldn't figure things out. So we have devices, kind of what's called iLux. It's a thermal pulsation device. What it does is heats up all those oil glands to secrete all that oil and unclog everything. We have devices called IPL, which is intense pulse light therapy. A lot of plastic surgery offices, dermatology offices also have them, really. So they're used to treat rosacea, redness, kind of provide a skin glow. But we have an FDA-approved device that we actually use to treat the eyelids. So the eyelids, when we're targeting that, can help control some of the inflammation and stimulate more oil flow.
This is from Kathy. She wants to know, does the Wang Vision Institute do any type of eye plastic surgery?
Eye plastic surgery. So like we were talking about, oculoplastics is another fellowship of ophthalmology. So we don't do oculoplastics. We refer to a local group.
Okay. What age group do you normally see when it comes to the chronic dry eye?
That's a really good question. So typically, it used to be kind of the females above 40, the elderly population. But with the advent of the smartphone and screens, we have seen dry eyes starting from the 20s, the 30s. So what screens do is decrease your blink reflex by 8-fold. So near work, looking at screens, looking at phones, just you don't blink as much, and then you're getting more and more dry. The other thing that exacerbated it was during COVID, masks actually, so when you're wearing all those masks, the air is kind of flowing up and kind of contaminating the eye a little bit, causing a little bit more dry eye. So we've been seeing a lot more dryness even in patients in the 20s and 30s. So for anyone that spends a lot of time on computers and screens, we recommend what's called the 20-20 rule. So for every 20 minutes of screen time, you want to look at something 20 feet away for about 20 seconds.
Interesting.
Yeah.
Never heard that before.
That's right.
I've heard of something called punctal plugs.
Yes.
How do they help with dry eye?
Yeah. So there's what we call 4 punctum. Punctum are essentially tear ducts that drain the tears. So we have 2 at the upper lid, 2 in the lower lid, and the tears drain through that. So when we do what are called punctal plugs, we put a little dissolvable plug in 2 of the puncta. So what that does is it slows down how fast the tears evaporate, and the tears stay on the eye longer, kind of helping with the dryness. So it's we like to use the dissolvable ones. Some people also use the permanent plugs, and in fact, that's a procedure that's even covered by insurance.
Somebody just wanted to know, do the prescription eye drops that help treat the root cause of dry eye, not just the symptoms?
Correct. So the prescription eye drops treat the inflammation associated with the dryness. So it can help kind of control everything, fight off the inflammation, and then just kind of rebuild your tear film. The cleaning procedures that we had talked about, kind of like the iLux and the IPL, those more directly attack the glands themselves.
Can the treatment actually make dry eye fully go away?
Yeah, so oftentimes when we're doing treatment, the goal is to kind of to get to them to either a dropless stage, so where they're not reliant on any more drops, or they just need to use artificial tears 2 to 3 times a day. So that's kind of the treatment goal that we titrate to here. So if we're starting with prescription eye drops, I'll tell patients to use the prescription eye drops for about 2 months and then just stop it, see how you do. It's not like one of those medications where if you stop it, it comes back. It's one of those where you've used it, now the inflammation's kind of gone, and now you just want to kind of maintain it. Same thing with the procedures that we do. We have patients that come in every 6 months or so to get those procedures done. It's kind of like a deep clean when you go to the dentist office. So it just really cleans up everything, kind of provides a nice basal tear film level.
In your office, Dr. G, you offer IPL and iLux treatments. How do those work, and who are they usually best for?
Yeah, so both of these treatments are used for the people with the gland dysfunctions. So iLux, what it does is it heats up all those oil glands and then expresses them. So it actually pushes out all the oils and removes all the blockages. So actually for the first day, patients might feel a little bit more dry because we've just expressed everything. But starting the day after, everything just kind of flows much nicer, helping patients with their symptoms almost immediately. With IPL, it's intense pulse light therapy. BBL, other terms that people may use for it. It's actually, it provides 2 purposes. It actually has also a cosmetic component to it. That's why a lot of plastic surgery offices and dermatology offices have them. And what it does is it helps control the redness of the face, skin, things like that. But for the eyes, we have a device that we could actually use to treat the eyelids directly. So it's done over a period of 4 sessions. And what it does is it stimulates all the vessels deep to the eyelids that are contributing to the inflammation and the dysfunction. And it can actually even help regenerate some of the oil glands that you've lost.
Dr. G, you love what you do, don't you?
That's right. That's right.
It's so obvious. Tell people how they can reach the clinic.
Yeah, there's multiple ways. Our website is wangvisioninstitute.com, or you can always call us at 615-321-8881. So,
someone just asked, can they actually request you?
Yeah, sure.
Because there's a lot of doctors in your office, right?
Yes, there are. So we have 2 surgeons. It's me, and there's another surgeon, Dr. Jones, and then we have 2 optometrists. So they don't do surgeries, but they'll see medical patients and help kind of assist with some of the evaluations. So typically, I'm involved a lot with the surgeries and the procedures, but hey, I see anyone that requests me. So
beautiful, Dr. G. We love having you on the show. You'll be back again with us next month. Thank you so much for taking the time today, and
thank you.
I can't wait for next month's show. Thanks, Dr. G.
Yes. Thank you, Steve. Take care, guys.
Good. That's Dr. Gaduro of Wang Vision Institute. We just call him Dr. G. We're going to go to a quick break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.